You see, we hardly value health until the sickness comes. Hello everyone, welcome to DJ's Fitness and Rehab. So in my previous video, that is thoracic spine mobility exercises part 1, I have discussed about thoracic spine rotational mobility exercises. And now in part 2, I'm gonna discuss about thoracic spine extension mobility exercises. So let's get started. Now let me start with my comfortable position, that is in 4-point. So coming into that position, stretch your both arms a bit forward, hold your chin up and then slowly go down with your chest towards the floor. Try to push down as much as possible and come back without holding to that position. If you are struggling with your neck while doing this, then you can rest your elbows in bench or chair or edge of your bed placed in front of you and do the similar action. Now, if you are struggling with front knee pain and unable to kneel in the ground, then you can do it in standing posture also. Here you have to stand by facing a wall in front and then bend forward towards the wall near about 30 to 40 degrees on your waist. Rest your elbows over the wall and place them along the line of your ears. Now try to hold your chin up and push your chest towards the wall and come back. Now the most easiest position but relatively less effective than others is in supine lying position. Here you have to lie down in face up position. Now place a foam roller or bolster beneath your upper back. Both of your knees should be bent. Hold your both arms straight and now you have to move your arms straight up and towards the ground. Your eyes should be following the palm of your both hands during the movement. And with that, arch your upper back as much as possible and come back. So this is how you can do your thoracic extension mobility exercises. Choose any of these positions you are feeling comfortable with and try this. And comment your queries in the comment box down there below. So now let me come to why and when you can do thoracic extension mobility exercises. Look, you can do at any day, anytime, because if this treats your shoulder, neck and back problem, it can also prevent your shoulder, neck and back problems. So as per prevention strategies, you can start it anytime, any day. So now let me shortly demonstrate how the mechanical problem occurs in our shoulder and upper and lower back due to a stiff thoracic spine. And for this, I need help of Mr. Skelly. So let's get started. So you can see this is our spinal column and you can see an up and down curvature throughout our spinal column. This concave structure is called lordosis. This convex structure is called kyphosis, and again in lower back it's in lordosis, and again in our tailbone it is kyphosis. So this is our neck spine, this is our lumbar spine, and in between, as I said, this is our thoracic spine. Contains of 12 thoracic vertebrae. Okay, so each thoracic vertebra is attached with ribs. Only one exception, that is cervical 7. So this is cervical 7. So cervical 7 and thoracic 1 first vertebra is attached with first rib, and the last or 12th rib, which is a floating rib, is attached with T11 and T12. Okay. So, and due to this rib cage attached in front, our thoracic spine has less mobility in relation to our neck and lower back spine or cervical or lumbar spine. This two bone is called scapula or shoulder blade in general terms. So this scapula has a good relation with thoracic spine and shoulder joints as well. So due to faulty posture, your disease conditions like arthritis, some sports injuries or autoimmune disorder, your back or shoulder scapular muscles try to lose its strength. So for that, the mechanical imbalances happen. And for the mechanical imbalances, the opposing muscles of the front pectoralis muscles try to pull the scapula in front. So when it pulls the scapula in front, the scapula is tilted internally and rotated upwards, which is called scapular dyskinesis. And for this reason, the space or gap between the scapula and the shoulder bone got decreased during the arm elevation, and you can see it causing impingement of the structures which are passed in between this gap. So it causing pain and restriction of the shoulder joint, and repeated this faulty motion causing more restriction, pain and hardening of the soft tissue structure in this area, causing more stiffness, and this is termed as shoulder arthritis or frozen shoulder. Here is a related study which has been proposed by W. Ben Kibler in 2006 on scapular involvement in impingement, signs and symptoms. And another study on the role of the scapula, which has been proposed by Russ Payne et al., which has been demonstrated and concluded weakness of the scapular stabilizers and resultant altered biomechanics could result in abnormal stresses to the anterior capsule structures of the shoulder, increased possibility of rotator cuff compression, and decreased shoulder complex neuromuscular performances. So due to this imbalance, the back curvature of the thoracic spine, that is kyphosis, was increased in nature due to the pull of the front muscles and the weakness of the back muscles. So as this kyphosis got increased, the lordosis of the neck also get increased, because we have to look upwards for the daily work, and compensation happen over in the cervical junction. So for this thing, the structure or muscles over in the back of the neck got tensed more and causing restriction of movement, hardening also in the soft tissue structure between the cervical vertebrae, creating osteophytes and pain, which is termed as cervical spondylosis. And here is a study which has been proposed by S. Noriander et al. On reduced mobility in cervicothoracic motion segment, a risk factor for musculoskeletal leg shoulder pain, a 2-year prospective follow-up study, in where it has been seen inverse C71 function predicts neck shoulder pain related to cervicothoracic articulation and yields a positive predictive value of 84%. So long-term increased thoracic kyphosis leads to stiffness in the shoulder, upper back and neck. And thoracic mobility exercise helps in generating movement and reducing stiffness in all of these structures. See, stiffness don't come from the structure itself. Rather, it mostly comes from our brain. So thoracic mobility exercises also providing motor control in terms of relearning or reminding weakened muscle structures how they used to work. And by doing this, it helps to reducing pain, stiffness and preparing these muscles for taking overload for strengthening work and minimizing the chances of injury. I believe do not jump into an ocean first. without learning how to swim in a swimming pool.
And the study on effect of motor control and strengthening exercises on pain, function, strength and range of motion of patients with shoulder impingement syndrome, which has been proposed by Yeon-hee Bae et al., has concluded the motor control and strengthening exercises program improved pain, function, strength and range of motion. These results suggest that a motor control and strengthening exercise program feasible and suitable for individuals with shoulder impingement syndrome.
I hope you all like this video. Please comment your queries and doubts in the comment box down there below. And please share with your near and dear ones to know them all these things. And don't forget to subscribe DJ's Fitness and Rehab and press the bell icon next to it. Till then, stay safe, stay healthy. We'll catch up with you soon. Thanks for watching.